Hello, I'm Rachel Flowers, Director of Public Health at Croydon, and every year I'm required to write an independent report about the health and wellbeing of communities here in Croydon. This year I'll be focusing on the LGBTQ+ communities. This report does not make easy reading. While we have a lot to celebrate here in Croydon, we have a long way to go before inclusion and equality. Within our community, discrimination and safety concerns continue to raise their ugly heads, making people scared. That is not right. However, there is optimism for the future, and there are things that we can all do.
Hi, so I'm Dan. I live here in Croydon. I teach people from around the world how to speak English.
I'm Saba, pronouns are she, her. My work is all around gender equity and hate crimes, mainly raising awareness and the voice of South Asian and women of colour.
Yeah, my name is PC Matt Smith and I am the Borough LGBT Community Liaison Officer for Bromley, Croydon, Sutton.
My name is Claudia Coelho. My pronouns are she, her. I am Queer Arts Lead for London Borough of Culture.
My name is Merlin Golder, local trans man, born and raised in Croydon. Recently started performing as Merlin the Grey. I'm also a local scout leader.
My name is Asifa Lahore. I perform as Britain's first out-Muslim drag queen, and I am co-host of Their Majesty as in Croydon.
I'm Harlow and I'm a woman of transgender experience.
My name's Michael, but I'm better known in drag as Mary Jane Holland.
I am the mother of a young gay man who's also an open drag queen.
Being able to attend sort of LGBT events here in Croydon, in my local area, is really nice. It's not something that I would have imagined I would have, growing up. Coming out in, it was Reflex, but it's closed down now. Croydon Pride, things like that. That's really helped sort of shape my identity and give me a sense of belonging and acceptance here.
I do LGBT+ talks with scouts, different troops, just give them the basics, and to be honest, the kids know a lot of this stuff. It's the leaders that just have no idea. I'm remaining out in the Croydon districts just so scouts can see me. If I had a scout leader that was like, hey, I'm trans, this is what this is, and these are the services you can use to help, things would have been a lot different for me.
I love Croydon. There's so much culture, diversity, there's so much going on here. When you get to know the people and the community, you can't not love it.
The events that we do have are always quality. They always feel very involved and they always feel like they are aiming at us. My first ever Pride was Croydon. It always feels the same. It always feels like my first Pride when I go to Croydon Pride.
Last year, transphobic hate crime was the most at 56%. This year it's gone up by a further 11%. So if you think about the trans community on its own, the amount of abuse and trauma and suffering that they're facing, the isolation, not having any support, not knowing whether they'll be able to get medical health care.
My role is predominantly to assist and support victims of all types of crime, especially hate crime and serious sexual assaults or sexual assaults in general. I will step in with an officer in charge of the case, and I will give them the support and guidance and education to be able to support the victim and their families. Reporting LGBT hate crime is really intimidating sometimes and can be quite daunting. And having that familiar face, someone that understands the community, I've found and we've all found, has made a massive difference in detection rates.
I think people are going to be worse and think there's going to be more discrimination in Croydon than there actually is. I've never specifically had a bad experience in Croydon. Majority of the time I find that bad experience happen with people at a setting like a school or a workplace. Whereas I feel like in Croydon it hasn't been that big of a problem.
When I moved to Croydon, I couldn't find a GP that was willing to accept my hormones and my trans journey, so I kept my GP in Lambeth. In terms of gender clinics, they're all in central London.
One of the biggest problems at the moment around the community that isn't really talked about in terms of health is chemsex, yet the number of deaths is increasing. I think London Ambulance Service gave a stat of 1.2 incidents a day they deal with, and the effect that's having on individuals' mental health, on their emotion, on their well-being, it is, ultimately death.
There are services here, there's not many of them. But yeah, what is here is working for people. There could be a lot more support. I suppose that comes down to funding. You know, the more people that come to Croydon, the bigger Croydon gets. You need to keep that going, whether that's just making the same service better or putting more money towards it, or making new services that cater to different audiences.
Got some beautiful spaces in Croydon that have been, Queer Croydon and their Majesties, but we need more. It shouldn't be a case of trans people referring trans people to services or having to commute into central London for a blood test.
I had to turn to the internet, but what really helped me was what I like to call the Trans Underground Railway Network, where we support each other and go, you can get hormones from this service, you can get access to blood tests on the cheap here.
I think I grew up in a generation where I knew something was wrong, but I didn't know what it was, and being transgender was just not spoken about. And my first connection with the term was actually just transphobic slurs that were held against me growing up, and I had physical violence, verbal abuse at schools, out in the streets, didn't know what was going on.
So I think personally we need to bring more LGBT support within the borough, and stop people having to go off to up in London or in Surrey, where there are better services and more charities and organisations. Yesterday I was dealing with a young lady, and she was presented to Croydon Hospital for mental health issues, and she didn't feel like she had a voice, and that was quite difficult to hear, and I had to be her voice for her. It would have been nice for someone to have sat down with her and listened why she was in crisis a little bit more at that initial stage, and to understand that actually her crisis was coming from the community not accepting her as LGBT.
So I suffer with childhood trauma, cultural abuse, and as a result of it, today I have fibromyalgia, I suffer with traumas, I have complex PTSD, and they're all things that if I'd have been given the support when I was younger, if I'd been listened to, if I'd been understood, I probably wouldn't suffer with today.
Having access to healthcare, like good quality healthcare, non-judgmental healthcare, availability of things like condoms or sexual health advice, and also just a sense of community. I think what's changing is that they are trying to get people out of clinics, and so making like test kits and like home kits more available, which is really important. Although one thing I will say is that Croydon has quite an established track record with this. I remember as a teenager, they would give out condoms and contraceptive advice and sexual health advice to teenagers, and it was all totally free.
It's just a jump to the left.
I mean, Croydon obviously is like one of the largest London boroughs. Claudia and I basically ended up naked with because we just saw so many queer people around the borough, but there was no sort of sense of point.
Connecting with their Majesties, I now perform, and I love it, but mainly I do it, one, to help with my own dysphoria, but it's really to outreach the community and just be like, you know what, trans bodies are valid.
We are a drag and queer performance space, but yet we've taken on these other little hats where we signpost towards services. We are in many ways counsellors. Yeah. We are helping people to go to appointments. We shouldn't have to do this, but we do this.
We do it because we care.
Because we care.
Always will.
Every year, in particular at Pride Fest, we get a bigger and bigger kind of crowd, and there's more support. That creates a sort of better sense of like safety and inclusion, and I think ultimately you just end up getting the best out of people when everybody feels that shared sense of acceptance. So I think the future is really bright.
Just more like education, especially with the way that like gender identity has evolved and people are more expressive with who they are. Then you can embrace everything and know everything without getting scared and shutting down.
When we're born, we just come to this world. We don't get to choose our name, our colour of our skin, gender, religion. All that happens is we just get born. But we do have a choice in what we do with our lives and how we relate to each other. And that's whether we choose to accept each other and value each other and love each other for the people that we are, or whether we choose hatred.
Croydon has a wonderful, vibrant, diverse LGBTQ community, but it also has many people who are part of the community who are afraid to be their authentic self, who are afraid to talk about their health needs, the discrimination they experience, the hate they experience. They can't talk to their GPs around their sexuality or gender identity, and we needed to learn more. So we asked members of our LGBT community what their experience was, and it's a very difficult read, demonstrating that we need to question more, to understand better, to get a vibrant and inclusive community here within Croydon. I'm delighted to do a video as part of my report in Croydon's Year of the Borough of Culture, representing the quality culture that the LGBT community have always brought to Croydon, indeed the whole of the world. There are many recommendations in my report, but my 3 key takeaways at this time are: we need to keep on questioning our assumptions. We need to actively support the visibility of our LGBTQ+ community and celebrate them and their allies. We need to be allies. And thirdly, is about representation. Are the members of LGBTQ+ communities around your decision-making table? One thing that you can do as an ally to the LGBT community is actually allowing people to be their authentic self and ask them what their pronouns are. My pronouns are she, they. If you would like to know more about my report, please look at the Croydon Council website. Thank you.